come on in, take a seat. My name is Lee, and I am the medical assistant that will be bringing you back today. Do you mind confirming your first and last name? All right, and it looks like we have you on the schedule today because you've been having some breast concerns. Yeah, tell me a little bit about that. Appears to be on both sides. Is it tender at all or painful? Kind of swollen and painful, okay. Do you feel any cysts? You just feel like they're kind of lumpy? Okay. And how long has this been going on for? Okay. Now, do these symptoms ever go away? Okay, yeah, so worse kind of before and during period, and then after your cycle, it's usually better. Okay. Oh, for sure. It is always better to be safe and come in, so don't even worry about that. Have you noticed any nipple discharge? Any skin changes? What about nipple inversion, where that nipple looks like it's kind of getting pulled inward? Okay. Have you noticed any swollen lymph nodes, like around your armpit area? No? Have you had any changes as far as your diet or caffeine? Any new medical conditions or any new medications that you've started recently? All right. Gotcha. And kind of equal on both sides? Do you feel like one breast has been a bit more symptomatic than the other one, or? Okay. And anyone in the family with breast cancer at all? And what side of your family? Mom or dad? And do you know roughly how old she was? Okay. Understood. All right. Well, I got all that information in. Let me get started on a chart here for you. I'll just take your vital signs, and then Leanne, the PA, will be in to do a breast exam for you, okay? For sure. If you could remind me or tell me of your height and weight. Okay. Thank you very much. Any questions before I do your vitals, or anything else that you wanted to discuss with the PA today? Just very concerned about the breast. I have to tell you, breast concerns are one of the most common reasons people come into the clinic. So oftentimes there are a lot of benign breast conditions that can seem super concerning, but are actually quite common. So we'll get it all figured out for you. Sure. All right. So, if you wouldn't mind, I'm just going to have you slide your arm through there. There you go. Excellent. Just going to take a quick listen, so I'll go silent for a little bit here. Pressure is normal. Just gonna slide that off of you here. There you go. Alrighty. I am just getting tangled all over the place here. Alright. So, we will do our standard temperature check. There we go. Alright, and this is going to go right underneath the tongue. Almost reading it here. Very good. Alright, temperature is normal. Let me just get everything reset up here. Let's flow this way. Alright. So, I will let Lena, the PA, know everything that is bringing you in today. She'll come in, do the breast exam. Now, given your age, you know, mammograms may not be very beneficial, so there is a chance that she may order you a breast ultrasound instead. So we'll just kind of see what she thinks, okay? For sure, yeah. Alright, so I will give you some privacy. It may be easier with the outfit that you're wearing if you want to just get undressed top-wise. And there's a drape that you could just wrap your chest with, and then she'll come in and do your breast exam for you. Not a problem at all. All right, I'll let her know that you are ready, okay? For sure. Best of luck to you. Hello. It is nice to see you. My name is Leanna, and I'm the PA that will be doing your breast exam today. Lee, the medical assistant, was just telling me you've had, you know, breast pain on both sides. They appear very swollen and tender over the past few months, usually before your period starts. Okay, just wanted to make sure we had all of that correct. Okay, so if it is okay with you, I am just gonna put some hand sanitizer on here. And then we will get started with the breast exam. Alright, I am going to just grab some gloves here. Do you have any questions at all before we get started? So I am just going to start with this breast here. So I am going to lift this a little bit. You let me know if you get too uncomfortable. Awesome. Just going to be kind of pressing around, making sure I don't feel any concerning cysts or anything like that. Are you feeling that tenderness today? Not as much because you're period, okay? Not a problem. Do you mind lifting this arm for me? Just making sure I don't feel any swollen lymph nodes. Very good. If it's okay with you, I'm just going to take a pen light to look at the skin closer. missing any skin changes, redness. Which is very good. And if you could lift that arm again. Okay. All right, very good. And I will let you know about my assessment after we complete the other side here. All right, and I am just going to reach over here a little bit to do an exam on this side. Just going to move this over and then we'll cover you up back here. Of course, you let me know if you have any questions. And can you lift this arm for me just to look at those lymph nodes? Make sure they're not swollen or anything like that. Okay, you could rest that arm down. Okay. Let me grab that pen light here. Again, assessing for skin changes on this side. Okay. All right. Awesome. So let me get you covered up here and let's have a little chit chat. So the good news is I think that what you have going on is a very benign breast condition. It's called fibrocystic breast disease. It's really, really common in people in their teens, 20s, 30s. And basically it's when, our hormone levels sort of determine how swollen our breasts could be. So with fibrocystic breast disease, we tend to find that patients have cyclical breast pain, meaning the breast pain is usually at a certain part of their cycle, normally at the time of the period or right before. And what happens is this hormonal or fibrocystic tissue swells up, which causes that swollen feeling, that pain. And oftentimes it can be, something that's very common and of course very benign, so nothing cancerous at all. Since this is a new change for you, I will write you a script just for an ultrasound to confirm in the areas that you're having the pain that there is nothing but normal tissue that's being seen there, but I have very low suspicion for this being absolutely anything dangerous or anything like that. Exactly, yeah. Breast tissue-wise, everything overall looks very healthy, so that's kind of the top of my diagnosis. But since again, this is very new for you within these past few months, we'll just get a breast ultrasound of the areas that are bothering you to confirm that the tissue is fine. Absolutely. So I am just going to write the plan here, and the girls will get you set up for that. But do you have absolutely any questions at all regarding the plan today? Everything's pretty straightforward. Awesome. All right, well, I am going to give you some privacy to get dressed. The girls at checkout will have your clipboard with all the information, and they'll be providing you with the ultrasound script and the number to call to get it scheduled. You are so very welcome. I hope you have a good day.